Welcome to this essential guide on understanding antenatal screening for Down syndrome. As a woman or a healthcare professional, it's crucial to be informed about antenatal screening for Down syndrome. Today, we will explore the antenatal screening for Down syndrome. Down syndrome, trisomy 21, is the most common chromosomal abnormality. In England, in 2020, 1 in 377 babies were diagnosed with Down syndrome. Down syndrome has a variable spectrum and can be associated with delayed developmental milestones, congenital heart defects, and gastrointestinal tract anomalies. It is impossible to predict or know the severity of manifestations before birth. Antenatal screening for Down syndrome forms part of the NHS Fetal Anomaly Screening Programme, FASP, and is offered to all pregnant women between 10+0 and 20+0 weeks of pregnancy. Nearly 2/3 of babies with congenital anomalies were detected antenatally. The type of screening for Down syndrome offered is based on fetal gestation. Women presenting between 10+0 weeks to 14+1 weeks gestation will be offered the combined test. If a woman presents late with gestation between 14+2 and 20+1 weeks, or if the nuchal translucency measurement as part of the combined test cannot be obtained, women are offered the quadruple test. The NHS FAS first trimester combined screening test is the combined test. The combined test assesses the chance of the fetus having Down syndrome, trisomy 21, Edwards syndrome, trisomy 18, or Patau's syndrome, trisomy 13. It uses maternal and fetal measurements. Maternal measurements, maternal age. The chance of a woman having a baby with trisomy 21 increases with maternal age. Maternal age of 20, 1 in 1,500 chance. Maternal age of 30, 1 in 900 chance. Maternal age of 40, 1 in 100 chance. Free beta human chorionic gonadotropin, BHCG. An increased level of BHCG in maternal blood in the first trimester is associated with Down syndrome. Conversely, a decreased level is associated with Edwards and Patau's syndrome. Pregnancy-associated plasma protein A, PAP-A. A decreased level of PAP-A in maternal blood in the first trimester is associated with Down syndrome, trisomy 21, Edwards syndrome, trisomy 18, and Patau's syndrome, trisomy 13. Ultrasound is used to assess the thickness of the nuchal pad at the nape of the fetal neck. Increased NT is associated with Down syndrome. The nuchal translucency must be combined with the maternal blood sample and cannot be used alone to calculate the result. If NT cannot be measured, at least one more attempt is offered twice on the couch, either on the same day or later, based on local guidelines. If NT still cannot be measured after a second attempt, women are offered the quadruple test. Crown rump length, CRL. This is measured to check eligibility for the combined test, 45 to 84.0 millimeters, and is a more accurate measurement of fetal gestational age than the last menstrual period. If the CRL is 45 millimeters, women are asked to attend another ultrasound scan to remeasure CRL and NT. If the CRL is 84 millimeters, a combined screening test cannot be performed. The gestational age is calculated using head circumference, and the women may be offered a quadruple test if measurements suggest greater than 14+1 weeks gestation. The quadruple test only screens for Down syndrome and is offered during the second trimester, 14+2 to 20+0 weeks. When NT measurement cannot be obtained after 2 attempts, or if ultrasound measurements suggest gestation greater than 14+1 weeks. Quadruple test measurement results associated with Down syndrome: maternal age, increased maternal age, alpha-fetoprotein AFP, low, human chorionic gonadotropin, HCG, or free BHCG, high, unconjugated oestrol, UE3, low. The quadruple test has a lower detection rate and higher screen-positive rate than the combined test, therefore is less accurate. Maternal factors can affect maternal blood markers, e.g. smoking. Therefore, a thorough history is required during the appointment and noted with samples for interpretation. The chance cutoff is 1 in 150 at term for both combined and quadruple tests. A lower chance test is less than or equal to 1 in 151. A higher chance result is greater than or equal to 1 in 150, between 1 in 2 and 1 in 150. Following a higher chance result, women can choose to have no further testing, non-invasive prenatal testing, NIPT, prenatal diagnostic testing, This non-invasive test is a blood test which assesses placental cell-free fetal DNA found in maternal blood and combines this with the mother's background probability of a trisomy. A result is provided of the chance of a baby likely having Down syndrome, Edwards syndrome, or Patau's syndrome. The detection rates for trisomy 21 using NIPT can be as high as 99%, depending on fetal fraction. Nevertheless, it should be considered a screening test only, and any positive test results need to be confirmed by an invasive prenatal diagnostic test, e.g. chorionic villus sampling or amniocentesis. The test is suitable from 10 weeks of gestation onwards. The test is unsuitable for triplets or higher-order pregnancies if the mother has cancer or a chromosomal or genetic condition, including Down syndrome. A prenatal diagnostic test is offered to all pregnant women with a higher chance test result for Down syndrome, Edwards syndrome, or Patau's syndrome, or if there are any unexpected ultrasound findings on an anomaly scan. This testing is an invasive procedure and, dependent on fetal gestation, will be either chorionic villus sampling, CVS, or amniocentesis. Women who are rhesus negative will be recommended to have an anti-D immunoglobulin injection after the procedure to prevent developing antibodies. CVS is indicated at 11 to 14 weeks gestation and involves the ultrasound-guided sampling of placental tissue by inserting a fine needle through the abdomen and into the uterus. A transabdominal approach is the most common method. However, transcervical CVS may be indicated based on placenta location, but there is a higher likelihood of vaginal bleeding post-procedure. A rapid CVS result is available around 3 days after the procedure, and the second CVS result is provided within 2 weeks. The second result focuses on the baby's DNA and rules out placental mosaicism, which implies that the genetic makeup of the placenta is different to that of the baby. Mosaic results on the CVS sample warrant a further confirmatory amniocentesis. Amniocentesis can be performed 15 weeks of gestation and involves the ultrasound-guided insertion of a fine needle through the abdomen and into the uterus to take a sample of amniotic fluid. The amniotic fluid contains the baby's cells and is a true reflection of the baby's DNA. The ease of the procedure is dependent on the position of the baby and the placental location. Women should be counseled that the procedures are uncomfortable. Some have described it as period pain. Cramping is common after the procedure. Miscarriage mostly occurs within 3 days of the procedure, but can occur up to 2 weeks afterwards. However, this risk is negligible compared to women of the same risk profile not undertaking the procedure. There is a less than 1 in 1,000 risk of a serious infection. If the result is positive for the baby having Down syndrome, women are supported by an obstetrician and/or midwife who explain the results. A consultant pediatrician, consultant geneticist, or genetic counselor can offer additional support. The anomaly scan offered between 18+0 and 20+6 weeks screens for 11 physical conditions. Some conditions are associated with Down syndrome, such as congenital heart disease and abdominal wall defects. However, it must be explained to women that fetuses with trisomy 21 may not have abnormalities detectable on antenatal ultrasound. This is in contrast to trisomy 13-18, where the prevalence of structural anomalies is very high on prenatal ultrasound. This scan is offered to women who do not want screening tests or prenatal diagnostic testing and wish to continue with the pregnancy. The test of choice is the combined test. In a monochorionic twin pregnancy, the chance result is the same for each baby, and 1 pregnancy chance result is reported. In a dichorionic baby, each baby's chance result is reported. Emerging research suggests that NIPT can be offered to women with twin pregnancies, regardless of chorionicity, as a screening test. Thank you for joining us in this educational journey on understanding antenatal screening for Down syndrome. Stay informed and take proactive steps to safeguard your health.